for, as I am a nursing student. Our guest speaker today is Jeanine Richmond from the sunny Jacksonville, Florida. Jeanine has a bachelor's degree of science in nursing and is currently working towards her master's degree in health administration. With over 20 years of experience in nursing, she is here today to share her journey with us. Please help me in welcoming Dr. Johnson's good friend, Jeanine Richmond.
Hi. So this is new to me. I think any of y'all that heard us as we were kind of logging in, you can hear me still? Yes? Yes? Okay. I've not been a presenter on Zoom before, so this is a whole new experience for me. And this whole sharing screen and sharing slides is different. And I want you guys to feel like this is interactive. So if you have questions, please feel free to jump in. I'm not savvy enough, I guess, to go back and forth between the slides. I guess you guys can see my face, but I'm looking at my slides in particular. So if you don't mind, I'll look at the chat box at the end and look for questions. But if you have something that as I'm talking kind of brings up a question and you don't want to wait to the end, this is very informal from my perspective. So please feel free to chime in. I don't get offended. I have a lot of teenage children at my house, so I'm used to being interrupted frequently, and it won't offend me. But thank you for this opportunity. I am a clinical research nurse at Baptist Health Research Institute. Currently, my role encompasses dealing with our pulmonary critical care physicians with our active ongoing COVID studies. I also work with our pulmonary physicians on studies. I work very closely with some of our cardiologists on cardiology studies. We also are branching into infectious disease. We have a brand new head of our infectious disease department, so I'm actually going to be working with her as well. I have another meeting scheduled later this week, so it's good that I get one of these Zoom calls out of the way because I'll be doing that with a group of physicians in a couple of days. So you guys are kind of my guinea pigs. And then also I will be starting to work with general surgery. That'll be a new adventure for me as well. But that's all great, right? But how I got here. I do have over 20 years experience at this point. And I did see someone in the chat who said they're going back to school after 20 years. I know that they mentioned I am going back to school for my master's. I am in the same boat as you are, and it is very confusing and very different from when I was in school 20 plus years ago. So I applaud you for going back. It's definitely a challenge. But when I was younger and when I was coming out of high school and trying to decide what career path I wanted to go down. And at this point, I have children that are kind of at that point themselves. And I didn't know what I wanted to do. I knew medicine intrigued me, the body intrigued me. Ironically, I wasn't really the strongest student in science as I was going through high school, but anatomy and physiology, biology, those two sciences definitely stuck out to me. And I had the experience of doing some volunteer work at this particular hospital while I was in high school. And I kind of knew that I wanted to work something in medicine, but I didn't know what. I didn't know what that looked like. I just knew that the body intrigued me. I wanted to help people. And this seemed like it would be an area that I could get into that wouldn't be boring, because the one other thing that for me personally, I can't sit at a desk all day, every day and do the same kind of thing all day, every day. I need a little bit of variety, and I like to be mentally stimulated as I'm going through my day. And I thought if I'm picking something that's a career, I want to make sure that it's something that I'm not going to get bored with. You know, the other piece of my decision making also came from kind of just a practical, unrelated to any of that, was that I had to figure out my own way financially as well. You know, my mother was a single mom raising children, and this was obviously back in the 90s. So I've dated myself a little bit, but she was able to get us through high school. And she made it very clear that when we got out of high school, if we had aspirations of going to college or doing anything beyond high school, that was going to be on us. So it to me, it felt like it put added pressure for me to figure out what my career was going to be and make sure that when I did go down that road, that I wasn't wasting time or money to do that. So, and I was quite the indecisive person initially. So I started at the junior college here in town. And I kind of took some of the general courses that we have to take, everybody has to take, right? As I was trying to figure out what I wanted to do. And I went through several different thoughts, right? Initially, I thought perhaps I would like to do physical therapy. There was something about that. I don't know. I've participated in sports when I was younger, and I've always loved sports, and I've actually had to work with a physical therapist. So I thought, well, maybe this would be an area that I would enjoy. And I did. I started doing some classes, and then I realized that there was a lot of physics involved with physical therapy, being totally honest here. And I just couldn't do physics. So I said, okay, that took physical therapy off the table for me. But then I thought, okay, well, as I was looking at this particular field, I learned that there was also occupational therapy, which was just kind of the sister to physical therapy. And I actually went pretty far down this path, took some courses, was ready to apply to a 4-year program. But the last thing that I had to do with occupational therapy was I had to do a certain amount of hours, similar to an internship, I guess. I don't remember what it was called at that time, but I had to work a certain number of hours, volunteer hours in this area. And I did. And as I did that, I realized I loved interacting with the people, but for me personally, it felt very cookie cutter. It was like, okay, if I have a stroke patient who can't move one side, I'm going to do this certain set of exercises with them every day. It didn't feel like the right fit for me, which was, I mean, that's fine, right? But then I was back to the drawing board and I'm like, oh, great. Now what do I do? So at the time that I was doing this internship, I actually was working here at the hospital. I was working in our pharmacy department as a pharmacy technician, because at some point I had thought, well, maybe a pharmacist. I also heard pharmacists made really good money. And so there was a piece of it that had to do with that too. So I was working in the pharmacy and I was taking some additional classes, trying to start looking at going down that particular track. But again, for me, as I was working in this area, I realized that I didn't have so much interaction with patients or with other people. And for me, it just really wasn't, it wasn't something that I thought was going to be a good fit. So back to the drawing board I went. But at some point during all this time, I was working here at the hospital, but when I was working in the pharmacy, one of the things that I had to do as a pharmacy technician was run the meds to the different floors. And I noticed I was becoming curious as to what was happening in the rooms. Now, full disclosure, when I kind of started out in, as an 18, 19-year-old going to school, trying to decide what I thought I wanted to do with my life, nursing was the last thing I thought I wanted. Again, I didn't want to deal with all that bodily fluid. Sorry, that was my rationale as an 18-year-old. I didn't want to deal with all of the other things that I thought nurses had to deal with. But at some point during the course of working around the hospital and kind of getting out there and getting maybe a little more comfortable with being in this environment, I started to get really curious about what the nurses did on a day-to-day basis. And I know there were times when we would have to run meds if an emergency was going on. We would have to run medications up to a unit. And I was like, well, what's happening in there? I was very, very curious as to what was going on. And so I decided, you know, again, going back to the fact that I had to pay for all of this, I said, and also because I had tried a couple of things and realized that they weren't a fit for me, I decided to start applying to become a nursing assistant to see is this something that I think I want to do? And so that kind of led into my introduction to the cancer world. And when I was applying to get out of the pharmacy and try to become a nursing assistant, I applied to several different units. You know, cancer was not my first choice as far as where I thought I wanted to be. It truly was the first place that they then offered me a nursing assistant position. So I thought, well, okay, you wanted this, you've been trying, let's see. And what I found was kind of what I thought, that it was, you know, very, very draining. And it was a very demanding unit. But what I found there, despite all of, you know, I mean, there's no nice way to talk about cancer, especially if you start working in that field. People hear, oh, you're a cancer nurse, and the first thing they want to say is, oh, I'm so sorry. There is a huge toll that it does take on you at times, but I also found it to be a very rewarding place to work. And I was never bored. I was always interacting with patients. And I wound up finding something far greater than I thought, you know, than I could have even imagined at that time. So at that point, I decided, yes, I think actually I might want to be a nurse. And so then I kind of went down the road of going through the program and training. I did graduate with my bachelor's in 1997. So it's been a little over 20 years since I've gotten that degree. And my first job was on the unit that I was working as a nursing assistant. So it was at Baptist Medical Center, and I was a staff nurse on the adult oncology floor. But that's not where my oncology nursing story ended. You know, I had worked around the hospital for a long enough time that I was actually able to take a travel nurse assignment and go work out at MD Anderson in Houston. It was one of the greatest experiences of my oncology nurse career, to be able to go to what they consider one of the meccas of oncology nursing, and really get in there with this amazing environment that's out there. I spent almost a year out there. While I was out there, I was specifically working on what they call the GU oncology floor, so genital ureteral, where I dealt with a lot of people with bladder, kidney cancer, prostate cancer, testicular cancer. It was very, very defined. Everything at MD Anderson was very siloed. So they had a unit for breast cancer, a unit for lung cancer, and then, of course, like a unit for GU cancers as well. I've realized as I was looking this over, I actually left one place off. When I left MD Anderson, I actually went and worked down in South Florida at a smaller facility called Largo Medical Center. And at that facility, it was oncology, but it was also a surgical oncology, medical surgical. It was a very small hospital, so we kind of got a little bit of everything there. And I was down there for a couple of years. Then I came back to Jacksonville and worked at Memorial Hospital as a staff nurse on their oncology floor, and then eventually kind of made my way back to where I had started here at Baptist. And I wound up going back to the floor that I had started on as that nursing assistant. But at the time when I came back, they had actually opened up a 6-bed oncology critical care unit. So that's where I started when I came back. And that would have been in 2002 when I came back to Baptist downtown. And I started off just again as a staff nurse on this adult oncology critical care unit. And then I spent several years there. And as I was there, I was able to kind of move up the ranks, so to speak. So I wound up becoming an assistant nurse manager. And then I became the nurse manager of this unit for about 5 years. I became nurse manager, I think, in about 2006, and did that from 2006 to 2010. Again, this was not something, that was not the path that I thought I was intended for, but it is the path that I wound up in. And managing was something that it was rewarding in its own sense, but it was also very, very demanding. And so after a period of time, my children were much younger, and after a couple of years, it just became too demanding. I was on my own with my kids, and Betty can tell you that I have 4 children, and they are all very close in age. And so at the time, I had 4 children that were between the ages of 6 and 10. And I really, really, really was tired of being tied to the hospital, which is something that at the time, the nurse manager, you had 24/7 responsibility for your unit. So it wasn't unusual for me to get calls on the weekend or at night. And I really, really wanted to focus on being mom. As much as I enjoyed leading the unit that had raised me, at least raised me in my nursing career, I really wanted to be able to be mom for my kids first. And I was finding that struggle as I was managing. So I was kind of left in this quandary. Well, what do I want to do? I had reached a certain level, and they had talked about me even possibly moving up a little further in the management chain. And I thought, well, that's a terrible idea, because that is certainly not going to get me out of, it's not going to give me more time with my kids. If anything, it's going to give me less time. But I didn't, again, what do I want to do? I didn't want to leave Baptist. I have been with this institution for a very long time, and I'm very happy at this institution. But I wanted something different. And so the opportunity came up for clinical research nurse. And I thought, I've no idea what this is. And kind of like my whole path, wasn't really what I set out for. Now, in fairness, I wasn't sure what I was looking for. I just knew I wanted something that was going to allow me to be mom first. And so when this opportunity came to me, I listened as the manager was explaining kind of what this role was. And I thought, oh, well, it still really didn't make sense to me, because I had never thought about this as a career path as a research nurse. But I knew one thing, that my priority at that time wanted to be being mom to the children. And this was going to allow me to do that. It sounded interesting, to be involved with things before they're out there and before they're FDA approved, to kind of be on that front line. But I wasn't sure if this was just going to be a stopping point in my path. I never envisioned that this was going to be where I found some of my most true passion. But I did accept the role, obviously, because it served my purposes at the time. It was going to be Monday through Friday. It was more of working hours, and there was no holidays, no weekends, which was really a huge draw for me at that time. And so here I went. So that's how I landed. And this was in the oncology area. And I wound up getting to have experience. I stayed in oncology research probably for about 4 to 5 years. I forget exactly when I switched, but during that time, I got to have experience with trials in breast cancer, in lung cancer, gastric cancer, pancreatic cancer. There was a whole host of others. There's just too many to put in a little slide there. But what I found was I got to interact with patients, I got to interact with my physicians, and I got to see things before they became available for everybody else. And for the why kid, because I was one of those why children, that annoys their parents and is like, well, why does this happen? Why, mom, why? It really piqued my intellectual self, saying, why are these people, these scientists, coming up with this particular medicine? And I came into the research in the cancer world at a really exciting time, because it was with the advent of the immunotherapies, which anybody that's not in the cancer world, that sounds very foreign. What are you talking about? Immunotherapies basically mean that they have created medicines that help teach the body how to fight the cancer itself. So the body recognizes, these medicines help the body's immune system recognize the cancer as foreign, and they also help boost up your own natural body immunity to fight the cancer themselves. Again, some of that still is probably very foreign, but you probably have all heard commercials on TV or maybe on the radio for nivolumab or Keytruda. So I was involved with those clinical trials when we were administering them to patients before it reached its approval point. And I can tell you some of the most amazing stories that we got to see. These patients come in and they were so sick, and then we would administer this. And of course, at the time, we didn't know what we were giving. That's one thing with medicine trials, across any discipline, whether it's oncology, whether it's COVID, whether it's cardiology. They're set up as placebo control, meaning that the patient could be getting basically a sugar pill or saline in their infusion, or they're getting the active treatment. But what we did see was we saw patients getting better, patients that prior to this had a very poor prognosis, and you might be talking months or years of a lifespan. We would see them go into a remission, and not only would they go into remission, but they felt better. And that was just one of the most amazing things to be a part of. And now, like I said, you can't turn on the TV without at some point hearing a commercial for some of these things. And I could say I was a part of this back when, helping to get it approved. So it was just a great experience, and it really kind of solidified my love for clinical research. One of the other aspects of research that I really enjoy is anytime you get a new study that's presented to you that your physician has brought to you and you're starting to work on, they have what they call investigator meetings. And that's where they kind of get everybody, whether it's a global study or whether it's just a US study, they get all of the physicians and coordinators or study nurses together. Used to be in person, now it's all virtual. But they get them together for what they call this investigator meeting, where you get to understand the whys, how they reached this point, what happened historically that led up to the place that they feel like this would be a good treatment option to explore for whatever the discipline is. And I always found those so intriguing, and would sit there just honestly like a total geek, and sit there and just write all of these notes, not even necessarily understanding what I was writing about, but gave me questions to go back to my physician afterwards and ask and understand. And it gave me such knowledge to be able to share with the patients when I would be approaching them about possibly enrolling in the studies. So just a very exciting place to be. For me, maybe not for everybody, but for me, this was definitely where I wanted to stay. Now, you say, okay, well, you did oncology research. Obviously, you loved it a whole lot. Why did you leave? Well, after a while, sometimes things just, you need a change. And for me personally, there were some changes going on when they were transitioning to Baptist MD Anderson that I wasn't necessarily so fond of, administrative wise. And I thought, maybe I just need something a little different, but I knew I didn't want to leave oncology or leave clinical research. So I wound up there was a position that was available within the Baptist Health Research Institute, where I still am an employee within cardiology. And I thought, well, okay, research is still research. It's just a different discipline of research. And so I made the transition. And that too has been just as rewarding. And it was very exciting for me personally, because I had spent so much time in oncology. But I'm still a nurse. I had worked on a critical care unit, so cardiology and cardiology nursing wasn't completely foreign to me. I did have to dust out a lot of the cobwebs from it because it had been a minute since I had been that staff nurse taking care of the patients, but it was still research. And so I was able to do, in the time that I've been over here working with cardiology, I've been involved with congestive heart failure studies. I've been involved with studies related to atrial fibrillation. I'm currently involved with one for hypertension, where they're actually looking at a new procedure to help treat patients who have refractory hypertension, that it doesn't matter how many meds they're putting these patients on, they still just struggle with this hypertension. And I've been involved very closely with our electrophysiologists, physicians, with new device trials, where they're upgrading devices like pacemakers and defibrillators. Most recently, I've been involved with one where they're looking at patients who would need what they call primary prevention device, where it's looking at they're looking at making the devices smaller and changing where they place the leads to get better connectivity and make it more convenient for the patients. And it's so interesting. I mean, to me, it's just so interesting to see all of this. And then again, you see it and you see it come to fruition, and you just think, I was a part of that. So I want to leave plenty of time to talk about COVID and give you guys time to ask questions. So then, how did we wind up in COVID? Well, I was doing just fine doing my cardiology research, and then COVID hit. And our department, a lot of what I was doing was outpatient. And so outpatient things kind of slowed down, and our department got inquiries. My boss at the time was getting inquiries about us doing clinical research in COVID. And again, the science part of me, I always joke, I said 5 words, and that was what landed me amongst this COVID world. The first time that he said, hey, I'm getting some requests about these new trials for COVID, I said, wow, that sounds really cool. If I'd have known what that meant, I may not have said it, because what ensued was I became the primary clinical research nurse for all of the COVID studies at our downtown location. What that translated to for me personally was that I basically lived here. I worked 7 days a week, 10, 12-hour days, all throughout that the big surge that we had a year ago, not this past summer, but the year prior, because we had 3 active trials ongoing at that time. Now, I get a lot of questions from friends and family about the vaccine and vaccine trials and some of the outpatient therapies. Remember, I'm working with an inpatient population, so the therapeutics that we were focused on were really to treat those sick patients, that whatever percentage the media wants to throw out at whatever time, that percentage of patients who aren't okay, who wind up in the hospital, who wind up very sick, and who wind up on the ventilator. We were working with those. I can tell you another thing that those 5 words bought me on top of all of this work and seeing all these patients was one of our trials. We wound up being, our center was the top enroller in this particular trial. Well, one thing that being a top enroller gets you is the attention of the FDA. So I can now say I have been a part of an FDA inspection for one of these COVID studies. It was very interesting, very stressful when the inspectors show up, because it's not like they give you a lot of notice. We basically got a call Monday morning that they were going to be on our campus the next day. So there was a lot of pressure to make sure everything was good, because they were basically coming in to evaluate, to make sure that the data that was being presented to them by the sponsor was indeed what really had transpired at our level. So if there's ever a question, I know there's a lot of mixed messages that go around with COVID and how could they have approved this so quick and what was the science behind it. I can tell you from firsthand experience, when the FDA shows up at your site, they go through every single patient chart and they review every single patient that was involved with that study. And for this particular study, we had almost 80 patients. And they spent 2 weeks at our site, 2 very long weeks at our site. But they went through every single patient. And that particular therapeutic there still is some development to be done. But we do still have clinical trials ongoing. Currently, I have one open. It's the 7th one that I've been involved with. This is a very unique time in our world. The last few years have been a very unique time. There's not a person out there that COVID hasn't impacted on some level in some kind of way. But I can tell you, having been in the trenches with these nurses, with these physicians, with these patients, most importantly, it is not a place, where people want to be. I always tell people, I don't know what your thoughts are. I don't know what you believe, whether you want this, you don't want this, whatever your choice is for your family has to be your choice. I just always say, I hope you never wind up on my side, that I have to see you looking like I do in that picture. And that picture right there, full disclaimer, that's myself and one of my colleagues. We did one study where we had to work very closely with our physician, and it was for our sickest patients, where they were actually looking at stem cell therapy for these particular newly intubated or newly placed on the ventilator COVID-19 patients. So we had a procedure we had to go through and draw up syringes for him, and so that was us just kind of, one of our other colleagues had asked what we were doing at that particular time, and we're like, that's what we're doing. As I said, there's still research ongoing. We still are getting requests for different types of treatments. But that's kind of where I am today. And I know we don't have a whole lot of time, so I will open it up if there's any questions. Actually, I think I'm going to stop sharing my screen so I can look through the chat.
Yes, there's a student with a question, if you can.
I see. Now, hold on. I'm showing my age. Person who works in that, do you honestly think the vaccine will become a mandate? Would you recommend getting vaccinated? Okay, I don't make recommendations because I'm not that person, but I can tell you that at our institution, it has become mandatory. I personally did choose to get the vaccine. Again, I think it's a personal choice, and you have to weigh that with whatever other factors you have going on, you know, in your life, your decision. I know people have opted out for medical reasons, personal reasons, or maybe they just don't understand. But I work in this area. I work in research. I also work with these patients. And so to me, it didn't make sense for me not to get it. I have been vaccinated. I've even just recently received the booster. So I've been fully vaccinated plus the booster because they just offered that at our institution starting last week. So I took advantage of it. But I think you all have to weigh that yourselves. I know for the nursing programs here in Jacksonville, most of the programs, because the hospitals here in Jacksonville are requiring their staff to get vaccinated, a lot of the nursing programs are also having to require their nurses who are going to come into the facility to do clinicals. They have to get vaccinated. So kind of a roundabout answer. But as far as recommendations, I don't make those. I can just tell you my own personal experience with it. How difficult was the transition from cancer to COVID research? You know, ironically, research, once you start doing research, and you will find everybody in our department landed on research accidentally. It wasn't something that any of us started out. And we have some people in our department that have been doing this for 20 years. You know, we have some people that are brand new, and there are some people that have been doing it for, like I said, 10, 15, 20 years. Myself, I've been doing research almost 12 years now. Once you learn what a research protocol looks like and understand what is going to be expected of you as a coordinator to facilitate that, then it's really a mechanism. It's a matter of understanding your protocol and knowing what you need from your physician, and being confident enough to have the relationship with a physician that you can tell them, because physicians look to you or they look to me as a coordinator. They need me to guide them to make sure that they're following everything. So should the FDA happen to show up, which is always a possibility with research, should the FDA show up, that we've done everything the way we're supposed to do, because there's a huge focus on human subject protection and making sure people have informed consent and they understand what they're signing up for. But as far as transitioning from cancer research to COVID research or cardiology research or anything else, the transition isn't as difficult as you would think. So.
All right, it's 1 o'clock already. I think we can end here. Thank you, Jeanine, again very much for your time and your sharing your experience. Thank you.
You're welcome. And Betty knows how to get in touch with me. So if there were any questions or you were too shy to ask, you can tell Betty. She can get in touch with me. I can certainly answer questions offline.
Thank you. Thank you all for coming.
All right.
Thank you.
Thank
Bye.
you. Bye.
Bye.